Hello, Latinos in Clinical Research. Welcome back to another episode of our series, Career Pathways in Clinical Research. It's actually very important to showcase different career pathways, and we actually encourage other people who want to come on and get interviewed. If you have like an interesting pathway, or maybe just one you think is interesting that others can emulate, we're happy to interview you. So today we've got one of our very own co-founders, the
Mhm.
the most Latino of all of us, Sauber. Chris Sauber, as you can tell by the name, he's uh the my partner for DSCS CRO, our consulting services for the sites, a bunch of sites that we own, um, CRA Academy,
Academy.
CRC Academy, and Latino in Clinical Research, and Clinical Research Circle, where we are all social investors. And ask us if you want to learn what that is. Subscribe to the Clinical Research Circle YouTube channel right now. Like, comment, subscribe, share. We're actually up to a lot of good, cool things on there. So Chris has an interesting background because, unlike all of us, I think Judy also, um, Chris never had any plans to be a doctor. You know, all the rest of us were all like medical school dropouts or pre-med dropouts. Chris never. Chris came out of right field. He was a very good amateur baseball player, semi-pro baseball player.
Okay, you're exaggerating quite a bit, but okay.
He's a very good amateur poker player background as well. But what was your major in college? You come from like computer
Computer system
background,
software. Yeah.
computer
No, wow.
software.
Computer
Yeah.
system software,
Yes.
yes.
So what is that? Like that's how did
It's
you
it's a cheap man's computer science.
So let's go back to college. Let's go back to college and then let's go like when you graduated college, what was your first job? And we'll like lead up to your foray into clinical research because I still remember
Sure,
the day I met you. And we can save that story, I guess, for this episode later. But let's give people a
sure,
taste of like your background.
sure. So uh, again, just to save explaining the difference because there really isn't a difference. So I went to a satellite school. So I went to the University of Washington. They opened up a satellite campus. So I went to that campus, and in order to qualify to get into the computer science program at the main campus, you had to have close to it was like a 3.8, which I didn't have. I had like a 3.3 or something like that was my average. So that qualified me for the satellite campus, right? So that's where I went.
Okay, that was still
Um,
better than my GPA. I was like 2.5 in college.
well, that's out of high school, and then I had after high school I had to increase my GPA, so I
Ah,
went
I
to a
see.
community college to raise my GPA. Anyhow, so did not like my senior year at all of college. It was rough too. I had all kinds of things going on. But anyhow, my senior year of college had a lot of personal problems, divorce and things of that nature. I was married at the time. And I'm not going to go into that background. Dan, you're aware of it. Anyhow, so
It's career pathway. It's career pathway, but yeah, I
sure,
understand. We'll
sure,
divert from that topic.
yeah. So anyhow, and I struggled through my senior year. I and I really wasn't very good at it. What I was doing. So when I finished, my first job had nothing to do out of because I went to college older. I was a little older. I started at 26 is when I went. So I don't like getting into my personal stuff, but anyhow, when I was younger, I wanted to be a police officer. Dan, you're aware of this as well.
Oh, that's right. I forgot about that. That's right. That's
Yeah.
right.
So thank God that's not what I became. This would be awful today, but
You picked the
um,
right profession because you're in
sure,
the, with Latinos in clinical research, you're on the side that society values. Unfortunately,
well,
police,
certainly
I
more
mean,
now.
that could have gone a different pathway back
Absolutely.
then. Uh,
Yeah, but well, he's kind of a police in research.
he's like the police of our ventures. Yes, Chris
Yeah.
is a very conservative. The when I partnered with him, well, we'll lead into that, but I partnered with him specifically because I knew where my weaknesses were, and we almost complement each other like perfectly in that sense. So I knew like if I'm gonna go big with this business, I can't do it on my own. And I needed to partner with someone like Chris. Chris was right there. I was working with him forever with the sites, and I saw
Hmm.
the way he's doing budgets and like really maps out everything. He's an Excel junkie.
I don't know about
I
that, but
forgot
yeah,
about
I
mentioning
like
that in the
Excel,
bio.
sure.
Yeah, he could like
That's
program things
interesting.
with Excel. Yeah,
Yeah.
he could like program things on Excel. I don't even know how to enter numbers in there. You know how to program things.
Yeah, well,
Yeah,
that's his IT background too.
Makes sense.
it's
There
Makes
you
helpful.
sense.
go.
It's
So
helpful.
good thing no police. All right.
Sure. So, and what really upset me about that, and the reason I never became a police officer was, at least where I was living at the time, they did not allow type one. I'm type one diabetic. They did not allow type 1 diabetics. So all the departments. So,
Mm,
and I found that out the first time when I was getting very close to being hired, and then they found out, and they said, "Well, unfortunately, we don't hire type one." So, very disturbing, and changed the plans of my life. But anyhow,
yeah.
went back to school, pursued the computer system software degree. A little bit older. I was again 26 when I started. Um, had to raise my GPA because my GPA wasn't even great out of getting the degree for law. Um, so I had to raise my GPA to be able to qualify to get into that. And as I had previously mentioned, I went through a divorce my senior year. Didn't do that great my senior year. Got through it, but didn't like what I was doing. So first job out of that was actually a business to business sales job. I stayed there for
Ah,
quite a while.
B2B sales.
Yeah, stayed there for quite a while. Um, Took a vacation to California back in 2006. Um, right as, well, I don't know if the economic disaster was starting then or not. I think it was more 2007. But anyhow,
Yeah. Yeah.
2006, came down to California, loved it. We came down here from Washington State in October, November, and when we left up there, it was pouring rain. It was 38 degrees. You know, we're all bundled up for that weather. We get off the plane in California. It's like 7 o'clock at night. And it's 80 degrees, right? Basically stripped down because you're wearing coats, um, and loved it. So I have relatives that live in California, and we went to dinner one night with them, and we were complaining about the weather in Washington, how beautiful it was here in California. And at the time, my uncle was employed at a large company, and he said that he could onboard me there if ever I wanted to move to California. No problems. He could give me any position I wanted. It's like, really? It's like, yeah. What do you make in Washington? I told him, and he's like, yeah, I could pay you more than that, right? All I got to do is move down. So went back up, talked about it for a while with my wife, kids. Said we're tired of rusting, right? In Washington State, just rains all the time. Um, so we sold our house, and we moved to California. And on the way down, and this is during the economic disaster, right? This was 2008, early 2008, I think. Yeah, that's right.
Yeah.
And uh, on the way down, so we U-hauled it down, right? Took us about a week to get from Washington to California because I had little kids. During that week, my uncle was fired from his job.
No
Yeah.
way.
So
Wow.
economic disaster, right?
Wow.
Nobody's hiring, and I have no job,
Wow. And in
right?
California.
And
Wow.
moving to California, right? So, needless to say, that put a lot of stress on my relationship with my current wife, who I'm still married to. It didn't go well for a while, let me tell you. So,
Wow.
um,
Did
we
you?
spent.
Because you're a cool. I've never asked you this, but I've never really seen you panic, uh, or get.
Yeah, I agree.
Were you panicking?
Not at first, but when I couldn't find a job, and that had never been a problem, and I started getting a little worried.
Like, how long did it take till you started getting worried?
So I finally had to take a job I just did not want, right? Because we came down with, after selling our house, we came down with about 200,000, right? Within 6 months, it was 100, right? Because nobody was working.
Wow.
That might be an exaggeration. It was probably a little more than that, but I don't remember exactly. But we had blown through a lot of money in a short
Mhm.
period of time.
Mhm.
And so I finally just had to take anything I could find, and it was a position I just did not care for. It was a different kind of sales that I don't care for. It was B2C. I don't care for B2C sales, right?
It's hard. B2C is hard.
Yeah, but thankfully it was a manager position. But I still don't like that. It's like I just have never cared for that. Anyhow, trust me, I tried everything. It was just the time, right? It was 20% unemployment or
It
25%
was bad
unemployment in
back then.
California.
Yeah, I think it was worse then than it is now as far as finding employment. Now we're in a time
Yeah,
where people don't want to work, but there's
yep,
plenty of jobs.
exactly.
Okay, so that was a time where, because that's kind of when I got started in research. That was a time where people were looking for work and couldn't find any work.
Exactly. So I worked there for a while and I took on a second job while I continued working there. And I met somebody that you and I both know, Dan.
Yep,
And he introduced me to you in a roundabout way.
it was a good patient recruiter that
Yeah.
introduced us.
Yep. And maybe it'd be better coming from you, but the first time Dan and I met.
Oh yeah, the first time we met, because I had a clinic in Anaheim. I had a clinic in Anaheim. This patient recruiter that I've got to know over the years, we opened a clinic in San Bernardino, which Chris and I still own it to this day. We changed the company name a few times, but it's still there. He
Purchased the
wasn't
building
a
too.
yeah, we purchased a he was not a good coordinator, this patient recruiter. Like there's no way he was going to be able to focus and be a coordinator. So, and he knew that. So he was like, you know what? I know this guy. So I came up there for a site selection visit to make sure that we would get the study. And Chris was there and we did the SSV. Chris didn't really say anything because he was research naive and we were
Right,
trying to
completely. Didn't even
completely
really know what it
research naive.
was.
And before the SSV, I was telling him, hey, I don't know who you are, but like I'll just talk, just like sit there and shake your head or something. I didn't even know who he was. And then the SSV was over. I think we got the study it went well.
We did.
And then I wanted to leave. I wanted to get out of there because I wanted to come back and not be in traffic. And that San Bernardino clinic was like a stepchild. Like you just go there when I have to, and then just get out of there. And then Chris, as I was leaving, Chris came up to me and said, I can't remember
I know
exactly how you
those. No,
said it,
I know those words.
but he said, hey, just to let you know, and mind you, we exchanged like 2 words this whole time. He comes up to me and says, hey, mind you, I just want to let you know I've never failed at anything in my life.
That's not exactly
And
what
I
I
was
said. That's not exactly what I. It's close.
that's how I remembered it. What did you
Anything
say?
I've put my mind to, anything that I put real effort into, I've never failed, which is true.
Okay,
I still
okay.
believe that to be true.
Well, the way I interpreted it was the way I said it, and I was like, okay. I don't even remember what I said. I was like, all right, and then I
You
just
can,
kind of
you kind
shook
of
my head and
smiled.
left.
You kind of smiled, and you said, "Okay, well, that's good to know." Like you didn't know what to say.
You're like, I gotta go. Thanks.
Yeah,
Thanks
and
for
I
the
left.
reassurance.
I left, but that stuck with me. And then the recruiter who I drove with, he's like, yeah, he's a good dude. Trust me. So I was like, all right. I mean, I like his confidence, but who says that? He's either cocky or confident. And I was like, all right, I don't really care at this point. We need somebody because I'm not going to do it. So we hired Chris, and he learned like quickly. I mean, how did you learn, Chris? You learned. I didn't train you. Did I
No,
train you? I didn't train you.
nobody trained me. What are you talking about? One of the CRAs trained me. Really?
I think I like monitored you as a study coordinator. I tried to monitor your study once, like to
Yeah,
prep you
you
for a
came
real
out.
monitor visit.
Yeah, you came up before the monitor came. my first monitor experience, and you reviewed the material for like 20 minutes. You say that there's some missing information here and there. I put post-it notes, just make sure it's complete before the guy comes. So it was like header information.
Okay. So not very helpful.
Yeah,
All right. So what did you do? How did you learn?
seriously, from the CRA. I don't
So
want to put him on blast, but he was a really good CRA, and he
okay.
knew because I think you or the recruiter, I can't remember which, but one of you told him that I was fairly research naive, and
I don't think it was me.
it might have been you because you had previous experience with him.
Oh, okay, okay. He
You
shares
know
a
what I'm talking
name.
about?
He shares a name with me.
Yes.
Okay, I know who he is.
Yeah, and
Is
I
the
think
same
it
one?
was
Is the same one I had or
no,
not? It's
I don't think
No.
so.
different because
Yeah.
he helped me a lot too.
Yeah. So, oh, well, either you or the other gentleman told him that I would probably need a little guidance.
So was it easier than you thought? What did you think of clinical research? Like you just showed up because you needed a job. You didn't like seek a career in
Correct.
clinical
Yeah, I
research.
just completely fell into it.
You had no clue what it was,
None.
right? Did you
Zero.
study it at all before you
I
showed
mean,
up, or
I mean,
because
I
this was
even
before my YouTube, so like there was nothing to Google on this stuff.
no, I knew nothing about it whatsoever. I knew what the recruiter had told me.
The patient recruiter.
Yeah, that's all I knew, and he didn't tell me a whole lot.
Yeah, no. So how
He
did
said
like
he said you just have to be very diligent and uh, observant and detail oriented, which I do have all those qualities to a degree at least. So I was like, okay, well, that should be right up my alley, not a problem.
was it harder to learn than you imagined or easier?
Um, I would say both. Again, I had no gauge, I had no benchmark because I had no clue what it was, right?
Hmm.
What I found was the things that I thought were relatively simple initially, like in documentation, I found that really you need a lot more detail, material, explanation than I initially had thought. But again, thankfully, the CRA was very helpful in that regard um, and guided me through that. I also think he had a fairly good understanding of the relationship at the site, right? The relationship between the coordinator, myself, and the PI. So he was very helpful in that regard.
Shout out to the CRAs that actually help, because yeah, I mean,
Oh yeah, absolutely.
we'll do
Yeah,
my story
that's
another day
right.
because this one's too good. But yeah, the CRA also helped like train me. I think we all have that
Oh,
in common.
wow.
All-
Yeah, we do have that in common. In my case was a male, and I have a really good relationship with him still.
in my case was a female, tough love to say the least, and I don't have a good relationship with her, but it worked. It
No,
worked.
but you're thankful for what she did for you, I
Yes,
assume. Yeah.
yes, absolutely. The intent was what mattered. But so okay, so you're learning, coordinating, uh, you're working with a mentally ill population, schizophrenic. So that's a whole
Mhm.
nother set of challenges.
Very interesting. Very
Yeah,
interesting.
yeah. So what was your? Did you actually like doing coordinating?
I actually did. I found it very interesting because these were all new aspects for me in my life, things I had just never really dealt with. Mentally ill, never dealt with it. I
Never
mean,
had any experiences like
again, getting into some personal information. My father served a few tours in Vietnam, so he left normal, according to my mother, left normal, came back very mentally ill.
yeah.
So I dealt with that, but at a very young age, so I really didn't grasp what I was dealing with.
Mm,
So yeah, I mean, I just as an adult, as somebody who was cognizant of their surroundings, what's going on, never
mm.
really experienced mental illness. Just found it very interesting, very even
So
comedic at times. I mean, I'm not being mean, just the things that they would say are just very interesting.
it's definitely an eccentric group when you talk about bipolars, and especially when they're manic and
Schizophrenics.
schizophrenia. I mean, it's a whole another set of challenges with those kind of
Hmm.
patient population. So usually around 6 month mark, 1 year mark of being a coordinator, you start to your eyes open up and you start to see opportunities within the space because
Oh, absolutely.
Because the first year you're just too busy like trying to learn everything, but
Yep.
then after that you start becoming self-aware and looking around and saying, okay, so what was your
Took about 2
goal?
years. About 2 years.
2
Took about
years.
2 years.
So what was
Yeah.
your goal at that like 2-year mark?
So what it was, again, just dumb luck, as becoming a coordinator was, even successful people will tell you, there is luck involved in becoming successful, right?
Oh,
And I
absolutely.
believe that. Anyhow, so the San Bernardino site fell on rough times. And I had thought, I'd started considering being a CRA. Had received a few offers from CRA recruiters, right? Where CRAs will ask coordinators if they've ever thought of being a
Yeah.
CRA. So they were trying to recruit. And so I started considering that, but at the same time, I was like, I don't know if I'd like all that travel. I have young kids. Not sure that's something I would want to do. But I wanted to make, more money, honestly, than being a CRC. So something occurred at San Bernardino. I don't know if you want to get into that, but the company was starting to fail.
Yeah, the San Bernardino
And so
branch
Dan,
started
well, it wasn't the branch, it was more the entire company. So Dan owned a number of sites and fell on some difficult times because research was tough at that time.
yeah. My big mistake, this will come up in my story, but my big mistake was expanding into the recession, which was naivete at best.
Right. So
Nobody does that, and we expanded instead of contracting during the recession, expanded with 2 new sites in San Bernardino and Norwalk, which we both still own to this day.
well, just
So it worked
started
out.
owning Norwalk again.
Yeah.
Yeah, hodl,
So,
hodl. It's like cryptocurrency. If you hold it long enough, it ends up
Yeah,
being
right.
good.
So Dan had to dissolve his company, and this is where there'll be some bleed over into our stories, but had to dissolve the company. So proposition Dan, well, why don't you keep it running and we'll become partners. And that's essentially the long and short of it,
Yeah.
right?
What
And
happened
everything
was,
from there is
so some investors came in on my end, people I knew, an NP and a PA, nurse practitioner and a physician assistant, and they didn't even care about the San Bernardino site. So I told them, well, I'll take responsibility for that. We'll get rid of that. We'll dissolve it, and then we'll just focus like the investment that you put in on this site, on the Anaheim site. And the Norwalk was like so small it didn't even matter. But San Bernardino was taking up a lot of our profits. So I said, I'll deal with that one. I'll deal with the lease. This is why I don't like personal guarantees. I'll deal with everything there. And then I was just brainstorming. This was like a very stressful period of my time. I was brainstorming, what can I do? And then I was like, well, I don't know. Maybe I'll like ask Chris if he wants to work for free and be a partner on the site. And, kind of made that call. And I think you took a few days to think it over and you said yes. So then we became like partners on the site.
I remember it a little differently, but who knows?
Yeah. Well, what do you remember? What do you remember?
So you had mentioned you came out. We went out to lunch, me, you, and the other gentleman.
The patient
And
recruiter.
yeah, and told me that you're gonna have to shut down the site. And I was like, okay. So this could be an opportunity. I thought a few days later. So I had a conversation with the main PI there and asked her if she would be interested, and then had a conversation with you.
Oh, okay. Okay. Yeah, I'm telling you, times are so hectic and stressful then that maybe how it ended up playing out. To
Yeah,
me, it's all like bleeds in together. But
sure. Sure,
the outcome was basically
you had many sites that you're dealing with in the same situation.
I
So
was putting out like 20 fires at that time. So I was like, all right, let's get this thing go out of the way.
right.
So how come what you choose Chris over everybody?
Say again.
Because there was 2 coordinators there. Why did I choose you? Um,
Well, you wound up choosing both
yeah.
because one of the partners didn't work out, and I mentioned that other person. I said, I think she would be a good fit. And you were like, yeah, I think you're right. So we talked to her.
Yeah, one of the partners didn't work out. Chris brought in the other coordinator, but it was really gonna be only Chris because he was generalist. I mean, all the stuff we talk about, he was the more of the generalist. He knew how to do sales to recruit patients. He knew how to handle SSVs better than the other coordinator. He probably was just as good, if not better, on the coordinating side.
I was doing budgets too at that time.
Yeah, and budgets. So it was, to me, it was like what we tell our students all the time, Monica. Like, the generalists are the ones when times get tough. The generalists are the ones that keep their jobs or get the opportunities. So that's Chris, actually, perfect example of that. From
And that
either of our
was
versions of the story, whether it's mine or his version, which are pretty much the same thing, just a little like nuanced here and there. It doesn't
right.
matter
Who
because,
approached too? Right.
yeah, generalist is basically who ended up with the outcome, with the favorable outcome, in that case.
And that, just to put that in a time frame, that was early 2012.
Yeah,
So when that all
2012
transpired.
2012 was the most stressful year of my life, and that's saying a lot because of COVID and all that. But yeah, 2012 was like the worst year of my life.
A lot of time has passed since then. You guys have really grown a business together and a
Oh yeah.
brand and name and everything. It's pretty awesome.
Oh yeah,
Yeah.
without a doubt.
Sometimes it's like, man, we can't believe it. I mean, the sites are even like starting to like turn a corner here. The one in San Bernardino, there's actually two companies there now that we both own in the same building, and we own the building, and then we're with Monica, we're gonna open the new one in Anaheim. And so yeah, I mean, the sites but the consulting and everything, all the business opportunities are great. Like, every year we keep doing better than the last year. So it's a good, the Chris, actually the only business partner I've ever had. Well, no,
That,
I've had other
that you could
business
stand.
partners.
That you could.
Yes.
Well, I assume you can
Yes.
stand.
I can stand, because I had, yeah, I can, because when we started the site, that was the first business, right? The San Bernardino
Right.
site. That was 2012. Around
And
2014, right? 2012 was
go
the
ahead. Go ahead.
site. Yeah. So you were my business partner for that site,
2012
2012. Around
started
20,
early 2012. Yeah.
yeah, early 2012. Around 2014, that's when things really started getting exciting, because my YouTube channel was starting to bring in like opportunities. Like, people were like, "Can you train us to be CRAs?" And I just kept saying no, 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 no. And like, after 100 people, I'm like, man. And same thing with site owners across the country watching the videos. They're like, "Hey, can you help us get studies?" At first, I'm like, no, 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 no. And then one day I talked to Chris. I'm like, "Hey, man, you want to like do something with this?" And I had opportunity to choose Chris or someone else who Chris and I both know. And I know I've made the right choice. I mean, there's no way one of us would have killed the other person by now, me and that other guy. So
Yeah.
Chris, because there was not enough complementary, skill set. And then there's also more humility on the side of Chris, because Chris kind of knows. I mean, I'm probably not an easy person to partner with. I recognize that, and Chris is like humble enough to step aside and just let me like go crazy sometimes. This other guy would never.
It's a fact.
He would never have done that. But at the time, I was thinking, like, okay, let's weigh the pros and cons of both. I gave it some consideration. It didn't take me long to pick Chris, but I did give it some thought. I'm like, yeah, no way. I'm glad it did, because it worked out well. And we keep doing like new businesses and like this Latinos in Clinical Research. And now Chris and I are trying to do this with you guys, Monica and Ashley and Judy, like the same kind of thing. Let's become
Mhm.
partners on this clinical research circle. So it just shows you the opportunities that are there, especially small clinics. See, if Chris worked at a small clinic, if he would have worked and gotten hired like at UC San Bernardino, or not, there's no such thing. Let's say
Riverside.
Loma Linda, right? Let's say you became a coordinator for Loma Linda University. I doubt, I mean, who knows, but I doubt that you would have owned a site, you probably would have gone CRA route or something because those places are so siloed. You don't get to explore other aspects like budgets and all that stuff you were
Mhm.
doing. So I think, but who knows? Maybe you're entrepreneur enough to where you would have done that anyways. But I think the advantage was working at a small site, even though there's risks to that with businesses going out of business. There's
Certainly.
advantages too, in the sense that more opportunities open up.
And I think the small businesses, what the small business offers is that if the business grows, you grow with the business. While
Yeah.
in big companies, the big company grows and probably you will grow too, but it's not the same opportunity as it is in a small company.
Yeah,
Yeah.
completely agree.
But yet, what do all
I
the job seekers do? They seek the prestigious places to go work when they have no experience. That's the opposite of what you should be doing, in my humble
Well,
opinion.
I think it depends on your goals though too.
True, true. Were you always
Right.
entrepreneur? Did you know you wanted to open a site though one day?
No, I didn't know I wanted to open a site, but yes, I would say I was always an entrepreneur.
Okay.
I mean,
So you
I
would
have a
have
similar story to you
you would have
in
eventually
terms like
stumbled
back in grade
into
school, selling candy, right, at recess to kids, buying 2 pounds of candy on the way to school to sell it to kids, right? I mean,
okay.
things of
oh
that
wow,
nature.
we have that in
You did the
common
same
too.
kind of stuff.
Yeah.
Monica too. Yeah.
Yeah.
We all did. So eventually you would have, let's say you never worked at one of my small clinics, you worked at Loma Linda, you think you would have eventually like still been a entrepreneur in research? Do you think? It's hard to say, but what do you think?
Yeah, I don't think I can answer that question just because sometimes you need a push if you're in a situation that
Yeah.
you need to take a risk, right? You need a push because, um, again, young kids make it difficult to take risks. You have
Yeah.
to consider them.
True.
So if there's no push, maybe not.
Yeah. Well,
Necessity
I
is the
don't.
mother of innovation.
Exactly.
Yeah. All right, cool. Well, Chris, definitely the business partner I could stand the most from all of my previous business partners.
Stand the
And
most. You guys love each other. Just
there's no way
like a marriage.
there is no way
Thanks,
we could have
Monica.
there's no way we could have grown our business like this fast and this quickly without Chris, because there's no way I would have done the things Chris does. Like no, zero chance I would do the things Chris does. So forever
Well, thank you,
grateful
Dan.
to
It's very
Chris.
kind. Kind words.
I mean, it's legit, it's sincere, man, because there's no way I would do the things you do, but you seem to enjoy at least most of those things that I don't like, and then vice versa. So it works out well. I think we complement each other well. And now we're ready with Latinos in Clinical Research to bring in you guys, Monica, Judy, Ashley, and go for it all.
Woo.
Go for it all. So good career pathway. Any questions for Chris, you guys? Monica, Ashley?
No, I mean, it was a pretty detailed story. I know you said, Chris, you don't like to talk, but
Yeah,
that
Chris
was
said
a
this will be
really
5 minutes. I told you it could be 5 hours.
You
It could
it
made
be
was
me
five
just
hours.
answer more questions.
Yeah, I'm far from being boring. Your story is amazing, Chris.
yes,
Yeah.
Amazing.
it's a really good
Yeah.
story. It really is.
I didn't
Oh,
know
okay,
parts. I mean,
thank you.
I knew parts of it, but not the whole thing. So very entertaining.
I like to be entertaining. It's good.
Yes, you are. Yeah. Plus, he has a really good sense of humor. So.
Well, I'm just happy to, like, know that we're all in this together. I think everybody has some really amazing stories. So far, everybody surprised me. So I'm expecting Dan to surprise me now because I had
There'll be
ideas
no
maybe.
surprises. I
We'll
live
Dan,
see.
in
We'll see.
public.
yeah, Dan puts it all out there. If you watch his videos, you know everything
There's no
for the most part.
surprises, guys.
For the most part.
Awesome.
There's only
Thank you
the
so
risk
much.
of revisionist history with me because I've said the story so many times. Every now and then, it like human memory is something that's
Yeah, it changes slightly.
yeah, it does. It's a weird thing.
Hmm It is.
Mandela effect.
It's actually good. I documented early on in my career, like my bio, so I could like 20 years from now look and say, well, that's closer to the truth because that's
What you said at the
closer to
time, what you wrote at the time,
Yeah.
but you
Yeah.
probably remember it differently. It happens all the time to me.
I know. It's weird.
Yeah.
Well, thank you, Chris. We
Thank you.
appreciate you opening up and sharing your story because no one knows you. They just say, okay, Chris, this guy comes on Dan's podcast sometimes. He likes fantasy football, but they don't know the details. Unless you're a client or a student, then you get to know Chris. You're like, whoa. Like a lot of our students who come over, they're like, man, I didn't expect that from Chris, but he spent 4 hours with me explaining regulatory. Like, that's the stuff Chris does. It's not really the stuff I do. Maybe I'll go like an hour.
4
Chris goes
hours.
like 4 hours. Chris
Oh,
will go
gosh.
4 hours with the students. So there's no way I can do that. Chris has patience for that. And I'm just too emotional and too manic for that kind of stuff.
No, but I think
Same,
something
same.
that you guys have in common is your generosity in different aspects. But both of you are
Yeah.
very generous.
Thank you,
Thank you.
Monica.
Very
Thank you.
nice.
So thank you guys for watching. Hopefully there's some similarities that, or you can maybe see some things with Chris. I think the biggest lesson here is be a generalist, and small is the new big. Work at a small clinic if you're trying to break in. But there's of course pros and cons to everything. So choose carefully and get your own life coach because this is not life coaching advice.
I'm so grateful that I met you guys. Really.
Thank you, Monica.
Because
Likewise.
Thank
I
you,
have
Monica.
learned so
Ditto,
Yeah,
much
ditto.
absolutely.
from
Likewise.
Likewise, there's a lot of stuff.
you.
Just like Chris does things I don't want. There's so many things you do I would never do. So and Ashley too. I
Oh
mean,
yeah. Oh yeah. Both of them. Both absolutely. Couldn't agree more.
absolutely. So thank you guys. Looking forward to the next career pathway interview with Cassandra, and then we'll eventually do mine at some point. And then Carlos, we got to get Carlos on here too.
Oh, I thought we were doing yours
Yes.
today, but I guess it's that
No,
went a
Monica
little
has
longer
to
than
go.
expected.
Monica has to go, and yours was like we can't double
Yes,
book it.
actually,
Yeah,
thank you. I'm
we can't
leaving
double
right
book
All right.
now.
it.
Bye,
Thank you
Monica.
guys. Thank you everybody.
Bye, guys.
Talk to y'all later. Bye
Hey,
bye.
don't